All right, everybody. Good morning, um, and welcome to another presentation. Hopefully, this will lead into why we are changing our warm-up soon, as some people are bored with it, and it's been around for the 2 years I've been here at FitCode. So, I wanted to go through implementation of injury prevention to your program and why warm-ups are so effective in preventing serious injuries. Definitely, injuries are preventative. So, this was done again at the Glacier Clinics by myself and then by Dr. Daniel Dodd. Dr. Daniel Dodd is a lab coordinator at Illinois State University and also a lecturer. So, good morning for those who are watching this in the morning, and if not, good afternoon. Either way, it's a great time to have a cup of coffee. So objectives, I want you to understand how injuries can be avoided, understand how to create effective warm-ups, and then understand how practice, game, and weight room warm-ups differ. Again, this is directed towards sports performance, but understanding the difference between practice, game, and weight room warm-ups is key. For those of you who may have other jobs and or are looking to possibly personal train, there's going to be differences in when you prep them for practice, for a game, and for weight room. Specifically for FitCo, we're going to look at the weight room warm-ups. Injuries. So the best thing we can do as a coach is to keep our athletes, in our case clients, in their work habits and or field of play. This can happen with proper programming, attention to detail, and great coaching. Coach every day and take no days off. So what we have done through FitCode is that consistency of coaching. Lately we have seen a lot of coaches take the warm-up off or just kind of talk and mingle. We need to start coaching that warm-up. Coach it like it's a normal exercise within our MTT programs. Coach it as if they've never done it before. We have to keep coaching, have to keep reminding how to cue and how to move. It's this preparatory period that we have, the 7 to 8 minutes, where we can do the most effective work on our clientele because we're allowing them to prevent injuries and to continue their workouts and continue to their goals. So what we mostly do wrong, we tend not to take the warm-up seriously, as I previously mentioned. We do not coach them like we coach our practices and or games or our MTT classes, and it's not specific to the person and or athlete. Is this your fault? Absolutely not. How do we fix this? Well, program your warm-ups just like you would program your practices, right? You want to be detailed. You want to program your warm-ups like you would program your strength and conditioning protocol. Understand warm-ups are the best way to avoid injury and potential season-ending injuries. We've seen some rash of injuries at some of our locations, and these all could be avoided with good cueing, good warm-ups. Some, of course, people are going to get injured and fall out a little bit. That happens. But if we do everything possible to avoid that situation, we've done our job. And then evaluations. So we look at being injured versus being hurt. Well, I always ask the question, would you have an athlete hurt or injured? Well, injured is the ability to still play or perform or do movement. Hurt is the presence of pain and the inability to perform a movement. Okay, so we have to know the differences when we're talking to our clientele, just in case they do come up and say they are hurt or injured. Athlete or team, so significance of injury. So let's take this into our adult clientele. Person is not able to perform, thus not being able to perform at MTT or continue the workouts, thus derailing them from their goals. And then team will look at work, their inability to go to work possibly, their inability to be home or work with the kids, depending on the severity of injury, really derails their personal life. And it really derails what they want to do in their life. And that is the whole object of working out, is to increase activities for daily living and be sustainable to our families. So lack of prevention. So looking at the sports performance realm, we have more single sport athletes. There's no prevention worked into the programs. Lack of communication. So let's talk about this with our adult clientele. We have more people trying to work out, right, because the obesity rate is so high, highest than it's ever been. But we do very little preventative workout. We do have a great warm-up, but we need to adjust that warm-up based on our clientele as well. And then lack of communication. In this instance, it's going to be between the coach and the trainer, or the coach and the client, right? So you're looking at the athlete trainer one here. Very big, because we got to be able to recognize poor movement or possibly pain, right? We have to understand that people will show pain by compensation, not necessarily by face and or talking. So we have to be really good at catching those quantitative movements, right? When somebody's squatting, they're not going as low enough, we have to look at those knees or hip shift. Maybe something's going on there. Evaluations would also help this as well. So we look at needs analysis. So How can we get ahead of the injury? Well, biological versus chronological versus movement age, right? Movement age is that training age. How long have they been in the gym? Chronological age, um, how far along the pattern are they as far as their development? And then biological, how old are they? Part Q, physician clearance, are they okay to do work? Level of athletic development, level of development in them, okay? Previous injury history, have they had any major injuries? Current state of development, where they are currently. And then single sport versus dual sport, don't worry about that for our clientele. Sport analysis, we look at movement, all right? We'll look at energy systems, and then we will look at how those tie into the previously mentioned individual analysis, okay? Evaluation. So, functional movement screen is a great screen. For those who don't know about it, scored on 7 tests, with 3 being the perfect movement, 2 being moderate, and 1 being non-moderate, and 0 being a failure. It allows you to see movement flaws, and it gives you and ranks a score, so it gives you a qualitative and quantitative analysis. That quantitative number, 14, has been shown in research to say, hey, if you're below a 14, you have a 40 to 60% chance of injury. If you're above that 14, you're clear for most movement patterns. Then we look at specific testing. In our case, it would be something like a pull-up, push-up, squat, right? Again, qualitative, quantitative, coach's eye. What we see necessarily does not always translate to the numbers that they put up. You can have somebody that's brutally strong, a big guy that's strong, that might hide an injury or hide poor mechanics. But if you have a really good coach's eye, you're going to notice that mechanic and try to stop them and prevent them from getting injured. Types of warm-ups. Well, we have different types of things here. We have 5 different things we look at. Mobility, range of motion among the joints. Flexibility, range of motion among the muscles. Static, holding a stretch for a period of time. Active, movement of 1 to 2 body parts. And then dynamic, total body movement. So in our new warm-up, we're going to really try to correlate these 5 different movement patterns, right? Weight room prep versus game prep. Right, so we got to understand there's differences between the two, or between the 3, excuse me, and then we're looking at post or recovery, right, which is crucial. Weight room warm-ups. This is what we're going to look at mostly for our FitCo clientele, and then I'll skip through the other end and then get to the recovery part. We're looking at 4 major areas that we want to do when we're warming up, right? We want to look at our central nervous system, our body temperature, coordination, and action specificity, right? Central nervous system, it's the key to the component for preparation. You must get the mind and muscle connection in order to perform at a high level. It's responsible for complex lifting and the ability for high output movements. It is also responsible for coordination. Very key. Okay, so we want to prep that central nervous system. We don't want to prep it too much. Body temperature. You want your body temperature to rise at a point where your heart rate is higher than resting and ready for movement, right? We want to be, in that window of optimalization. So we want to have somewhere on our RPE scale, ratings per perceived exertion, Borg's rating scale, of maybe a 6 or a 7, ready to go, a little not winded, still able to talk, but ready to go. If your heart rate is too low, your body is not prepped and injuries can occur, so we don't have that movement of the blood to our muscles. Again, coordination action specific, so we're looking at body awareness, feet coordination, and sport specific. Body awareness and feet coordination, very key when we're looking at people warming up. For instance, that march, or the Frankensteins, or the knee hug to lunge, or the lunge, tippy toe walks. That kind of stuff, we need to have them look at body awareness. If we have somebody that has a hard time balancing, I can guarantee you that they're going to have an issue with a single leg RDL, or any single leg movements, or even getting into a proper lunge pattern. Feet coordination, again, learning how their feet move and where to step and where to kind of hold that balance. Some things you can use in the agility ladder. Obviously, we don't have the time or the room to utilize that in all of our MTT classes, and it's time consuming. So other things you can do tool-wise is put those within the warm-up and make the warm-up simple to complex. Example of mobility within training. If you take any of our strength classes, you will notice that the power block is essential for creating mobility within that program and a course. So you got the hang clean here. We can replace it with sandbag clean. After you do that sandbag clean for that 5 reps, you will then do a mobility exercise and then possibly a core exercise. These 2 right here are key into getting proper rest here. Most people do not get proper rest, and they go 5, take 10 seconds, 5, take 10 seconds, 5. What does that do? Burns our CNS out, creates injury potential. So let's go through the practice warm-up. All right. Example of an overall warm-up. So we want basics. We want mobility. Wall ankle prep, ankle circles, thoracic rotation, internal and external. So we're looking at from the ground up. Gary Gray and Gray Cook along with Mike Boyle, creating the joint-by-joint approach. That is within our office as well at Mokina location. Very simple. We look at our ankle, knees, hips, low back, upper back, shoulder. All those are linked together in some way, some facet. Ankle is a very, very loose joint. It moves in all directions. It being a joint in that way, it really sets up that knee for what it's going to do, right? That knee is a hinge joint, only meant to bend one way. We get up to that hip, again, we're looking at a ball and socket, a lot of rotational movement in there. Low back, pretty fixed, right? Pretty important joint, most for flexion and extension. We get up to that thoracic spine area, we're looking at rotation, right? If we have a locked up scapula, it's going to affect us pretty heavily. Active, rolling toe touches, active leg raises, a lot of what we do in our strength warm-up. Dynamic, again, moving from slow to complex, ending in something like a butt kick or karaoke or walking leg kicks, Frankenstein's in our case, or high knees that we do, high knees or jumping jacks at the end of our warm-ups. Here's an example of a specific warm-up. If you look here, guys, you can see that I have activation, ankle prep here, and then dynamic. So when we're looking at our strength programs, very, very similar to all of this, okay? And again, we can make it as specific we want for each individual. So post-game, all right, so we're looking at recovery here. Self-myofascial release, pre and post, I don't know. A lot of studies come out saying that pre or previously to the warm-up, it sets yourself up for more for recovery than it does for action. Static stretching pre or post, again, old debate. I'm a big post static stretching guy. It opens those blood vessels up, carry more blood in there, and release the poor blood out, thus creating recovery. Both are really good things to do post. A lot of people don't have time, especially in our MTT classes. But again, preparation is key. If you know somebody's really sore, they might want to roll out a little bit before. Tell them to come 5 minutes before or stay 5 minutes after. So conclusion, what do we want to look at? Well, injuries, especially little ones, are preventable. Script and coach the warm-up like anything else. Please take it serious. It's very important that we look at our warm-up as some integral plan of our workouts. Yes, I agree. The goal at the end of the rainbow is those workouts and cranking those away, getting hyped up for them. Nobody gets hyped up for warm-ups. When I was an athlete, I hated them. So important. So important, because without proper warm-ups, we don't get those people into our program for a continuance of the whole entire program, right? We need to have them fulfill that 6 weeks in some cases, or their membership, so they can attain their goals. The end goal is for the client. All movements are slow to fast. Be very consistent in your cueing. Always cue the same way, okay? So, for example, thoracic rotation, toes down, butt towards the heels, hand on the back of that head, rotate up, drive that belly button up to the sky, right? Anything we're in quadruped position, toes dug into the ground, hands, shoulders underneath those elbows, elbows over the wrists, eyes up, flat back, right? So we have to be very consistent in how we cue. We have to cue all of them and explain each warm-up phase or each warm-up movement to a T. We have to go through that all the time and give examples. Remember the old thing, right? We demonstrate, we cue, and we demonstrate, we walk around and help people. All right, we cannot lose that as a company. So I want to thank you guys very much. I appreciate all you, listening to my spiel. A lot of times I walk around and do the consistency checks, and it's very important to us as a company to make sure that we are consistent throughout all locations. We got to make sure that the people that we are catering to have our attention at all times. From 4:15 a.m. all the way through 8 p.m. It's an integral part of our community that we keep us as a community and community based. There's been a lot of talk, a lot of not watching when we're warming up as classes are getting bigger and more full. But with that comes more people with less experience. It's more important now than ever that we cue our warm-ups, that we prep them for these workouts, and that we cue those workouts as if it's the first time they've ever done that workout. I will see you guys around. Thank you very much for paying attention. I hope this was a little more clear than the last one. Thank you all. Have a great day.